Ladies and gentlemen, the webinar is beginning. Welcome. My name is Chris Wilson. I'm the Communications Director here at the Dallas-Fort Worth Hospital Council. Our President and CEO, Stephen Love, sends his apologies. He could not make it today as he had some personal issues that came up. But I wanted to thank you for being here today for this webinar hosted in coordination with Unity Medical Alliance, an associate member of the Council. Today we will be discussing maximizing ROI on lab service through efficiency, time savings, and cost reduction. Unity Medical Alliance is a healthcare sales organization that provides medical solutions for manufacturers and sales representatives. They offer turnkey solutions for lab services and all of your testing needs, to include PCR, antigens, COVID rapid tests, blood, allergy, mental health, women's health, and so many others. Our speakers today are Terrence Green, President of Unity Medical Alliance, Joe Case, CEO of Molecular Lab Partners, Mariska Carter, CEO of Medi Marketplace Incorporated, and Erica Tatum, Vice President of Medi Marketplace. What a great panel of expert speakers, and we're looking forward to their presentation today. We're so glad everyone's here. A final note, please feel free to ask questions during the presentation. You can do this by typing them into the question box or the chat box, and we will monitor those and make sure we provide answers before the program ends. And with that, ladies and gentlemen, without further ado, please welcome Mr. Terrence Green.
Good afternoon, everyone. Thank you so much, Chris, for the introduction, and thank you so much for this opportunity to speak to everybody today. And again, this is not about me. This is not about Unity Medical Alliance. As Chris mentioned, we're just a sales organization. We do not own any products or services. We do not manufacture anything. But what we have done as a company since our inception back in 2014, we have been very fortunate to align ourselves with wonderful strategic partners. And this is why I'm extraordinarily excited about introducing our guest panelists today, who are going to really do the heavy talking today. So without further ado, I would like to just again introduce you to Mrs. Mariska Carter and Mrs. Erica Tatum, again, of Medi Marketplace. They are wonderful people, and we've developed a tremendous relationship. And then Mr. Joe Case is going to chime in where necessary. Mr. Joe Case of Molecular Lab Partners, who is where our strength is within our partnership. So again, Mariska, if you're ready to take over, please feel free to jump in and kind of introduce yourself.
Absolutely. Thank you, Terrence. And thank you, everyone, for not only taking the time out to actually join the webinar, but for actually having us on the webinar today. Again, my name is Mariska Carter. And although I am essentially head of Medi Marketplace, most importantly, I am one of the regional vice presidents of Molecular Lab Partners. And as Terrence mentioned and Chris mentioned as well, I do have my partner Erica Tatum on the line, as well as the CEO of Molecular Lab Partners, Joe Case. And as I get started, I do want to sort of give you a little bit of background about who Molecular Lab Partners is. First of all, our inception has been short. We essentially came to be in winter of 2020. And it was essentially born out of molecular testing being born out of a need for the marketplace at that time, but also Molecular Lab Partners was born out of a past and previous relationship, and also strategic partnership that our co-founder and CEO Joe Case had from days, I guess you could say days of past, many moons ago, maybe as far back as 2012. And since our inception, we have not only grown rapidly, but we currently service, I'd say, in excess of 150 active customers to date, whether that is physician office laboratories, reference laboratories, or even some hospital laboratories itself. So we've got quite a bit of customers to date, and we'd like to also tout that we've got quite a few very, very happy customers as well. So simply put, I would like to say that our team has created a turnkey process which enables clinicians, reference laboratories, and also hospital laboratories to create a PCR molecular-based platform, essentially in-house. And essentially what we do is we're going to provide, or we provide services from A to Z, from a consultant basis, from an implementation basis that allows a partner or partnership to actually get up and going, from testing, from consulting, again, from implementation. We basically step in and we do all of the heavy lifting. We'll help you align with your idea. We'll help you create the plan. And most importantly, we're very efficient in terms of implementation. So what does that essentially mean when it comes to in-house testing, regardless of what your lab type is? It allows and supports the clinicians from an immediate diagnosis standpoint. It provides the ability to conduct those lab tests on site and have the results available during the same office visit or same visit of the patient within the facility. It allows the clinician to properly diagnose and monitor a patient's condition again immediately. It allows for faster decisions or treatment decisions to be made. Having lab results at the point of care, it enables a clinician to, again, initiate and or adjust the course of treatment for a patient with one or more medications. It keeps them from actually having to be sent home on one medication and only to get lab results back at a later time and having to actually make an adjustment. And also, again, just as I stated, quicker medication adjustments. When lab results are available at that point of care, they can immediately make that change, heading off any deteriorating condition that the patient may be experiencing, and which may result in an additional emergency room visit or hospitalization. So essentially, the clinical benefits for these patients also translate into financial benefits for the organization. Basically, time and time again, in virtually every aspect of healthcare, a healthcare delivery system, better efficiency in terms of being able to treat a patient is also better for business as well. What molecular testing has proven over the past couple years, for those that we've introduced it to, is it's allowing now profit or reimbursements where reimbursements or profit wasn't actually considered before. Again, it creates a greater efficiency in terms of the clinical workflow, and also, from a, I guess you could say, from a practice standpoint, a clinical standpoint, if you're able to actually provide in-house testing and your patients actually know, again, from the clinical workflow, being able to treat the patient more efficiently, et cetera, it will help you attract new patients and improve physician ratings for those that you're supporting as well. So let me talk to you about exactly what all we do here at Molecular Lab Partners. Again, we actually participate and will create end-to-end implementation. And that goes from those who do not have a current PCR laboratory to even supporting those who currently have a PCR laboratory and are interested in our proprietary assays. So as I stated before, Molecular Lab Partners will create the lab design if needed. We assist in staffing. So if there's a lab director, technical supervisor, general supervisor, or a medical lab technician that is needed, we will help source that staffing need, ultimately allowing the end client to choose exactly who we've vetted properly and sent over. We assist in the licensing if needed, CLIA and or COLA. We assist with equipment procurement as well. We do have relationships with several vendors, and so where equipment is needed, from something as simple as a PCR workstation, biosafety cabinet, or the PCR instrument itself, we will procure those items for our clients. We provide the operational documents, which are our SOPs, et cetera. And we will provide the lab personnel training. That's very important. I will say that with regard to the fact that I believe, and Joe may correct me if I'm incorrect, I believe we have around 18 PhDs on our staff. Our validation process is also very efficient. You'd be surprised, and I get into the little details a little bit later about our validation process and how quickly and efficient it basically is, whether, again, it's a new laboratory that we're bringing from the ground up, or whether it's an existing laboratory who, again, is taking on our assays and would like to actually benefit from a quick ROI really quickly. And again, after this entire process is done, testing can begin. I'm going to skip through this picture. This is just a small example of how we basically set up something as efficient or small as a physician's office laboratory. We're able to get a full PCR laboratory in a very small space. And as you can see, in terms of that setup design, everything is in place for a physician to actually, get up and running. But we also, again, we service reference laboratories as well as hospital laboratories. So from our expertise, whatever the case may be, we can assist with regard to lab planning, design, procurement, et cetera. So let's talk about one of the things that makes Molecular Lab Partners special, and it's our proprietary plates. We actually, again, have our concierge consulting services, but we're more than just that. We make molecular testing fast and easy, regardless of the facility. And we're able to do so with our custom plated assays that we actually create, and we utilize convenient breakaway plates that I'll describe a little bit later in more detail. By utilizing this type of plate system, we help the end client eliminate costly waste, and also we help increase volume and or throughput. And of course, all of that is essential and is a key to success in terms of running a successful PCR laboratory. So I'm hoping you guys can see this, everyone on the call, on the webinar can see this sufficiently. These are our current panels in production. And one of the things before I actually go through our panels, I wanted to actually point out is that these are panels or assays that we produce. These are not produced by a third party. These are what we manufacture in-house. We manufacture using an automated system. And one of the things that also makes us special as well is that should you have a need or place an order for our assays and you're wondering what our delivery time looks like, you'd be very pleased to know that if you place an order today, 9 times out of 10, your order will be overnighted and you receive it tomorrow. And that's one of the benefits of in-house production. So our current panels in production are currently our COVID-19 assay. This is an extraction-free process. I'm going to describe what that means in just a second. We have a COVID flu, which includes influenza A/B. We have a COVID respiratory light that includes a few more pathogens. We have an RPP assay. We also have an RPP plus assay that includes additional bacteria pathogens as that panel has been expanded. We do have a UTI and wound assay with antibiotic resistant markers. We also have an expanded UTI plus panel, which has more pathogens and again with antibiotic resistance markers as well. We have an STI panel, and we have a very robust vaginitis panel as well. And one of our last panels that we have is our fungal panel. Again, all of these panels are produced and manufactured in-house. So since we are wondering, or we're talking about when we want to discuss ROI or maximizing your ROI, I think it's very important for us to actually talk about our assays that we have produced and what the ROI looks like. So we do share this with all clients, and this gives you an opportunity to see exactly what our CPT codes are per our panel assays, the pathogens in them. We give you an idea of what our Medicare reimbursement is per panel, our Medicaid reimbursement, and also Blue Cross Blue Shield of Alabama. Why Blue Cross Blue Shield of Alabama? Well, we actually produce our assays and are mainly headquartered out of Birmingham, Alabama. So when an order is placed for anything, it is shipped from our headquarters in Birmingham. So as you can see, we have our CPT codes, we have the pathogen list, and again, you see exactly per CPT code, per pathogen, what your reimbursement would look like. So for our COVID respiratory light panel, you can see average Medicare reimbursement of $336.16, and also for the expanded panel, the total reimbursement would be $616. This also, panel coding, it also includes our respiratory plus panel or respiratory panels as well at the 616 and then the 930 and some change. I have actually moved on, and you can see here, even when it comes down to our UTI and our UTI plus panel, UTI with regard to its existing pathogens, as you can see, we've got an average Medicare reimbursement of $772, Medicaid at $632, and Blue Cross Blue Shield of Alabama, which also happens to be one of the, if I have to say something about Blue Cross Blue Shield of Alabama, you're probably looking at a really, what am I trying to say? A conservative reimbursement. Blue Cross Blue Shield of Alabama is probably one of the payers that has a reimbursement that's very, very conservative across the board. If you look over to your right, you'll see our UTI plus panel with its average Medicare reimbursement of $982 and so on. So when you're looking at our proprietary assays and you're looking at ROI and maximizing that for your laboratory, your organization, et cetera, this is exactly what you could be looking at per assay. And I will also move on to some of our last panels as well, which is our wound and fungal panel. Our wound and UTI plus panel are relatively one and the same. So as you can see, you're probably seeing some of the reimbursements that you just saw on the previous slide. And then you see over to our right where we've included our fungal panel as well, per CPT code, per pathogen, with an average Medicare reimbursement of about $666 and change. So hopefully when you're, again, thinking about an ROI for your laboratory, without question, I'm hoping that you're very pleased by what you see here. So before I actually move on, I'd actually like to just drill down to a few things to me that, and to probably some of our clients, or a lot of our clients as well, which makes us special. So when you're looking at molecular lab partners, number one, we work, what we found is that the labs that we've actually worked with currently, we often find that our standard panels, which some of what you see right here, actually reimburse better than the panels that they're currently running. So again, from an ROI standpoint, not only are you actually getting, you know, cost savings, efficiency, which I'll elaborate in just a second, but you now have an increased ROI that actually, in some circumstances, you'd be able to capitalize on in less than 30 days. We have pre-plated assays. And so our proprietary plates actually feature a ready-to-run pre-filled wells. And so from a laboratory standpoint, or probably some of the lab technicians can attest to this, when you have a pre-filled plate or a pre-filled well that is already consist of some of the things that you would actually buy independently, such as master mix, such as tack. It saves a lot of time in terms of prep work before basically being able to run a test. And that time could actually be 20 to 45 minutes per. What it actually means is that the technicians in the laboratory won't need to pipette anything except the samples themselves for the most part. And again, if I go back to how we manufacture our plates, automation creates exact assays every time. And that's very important. What that means is we're reducing human error. The other thing that makes basically working with molecular lab partners really special is the fact that we do use tearaway plates. And what that means for you as an end client is there's virtually zero waste. So for instance, if you've had a full day of laboratory testing and then you basically get to the evening or maybe sometime later in a shift and you do not have a full plate's worth of tests that need to be actually run, you have the ability to tear off exactly what's needed from that plate to run, and the rest can actually go in the freezer. Again, eliminating waste. So not necessarily having to burn through what we call a whole assay full of tests. And therefore that's money saved. So you're eliminating waste, and from a technical standpoint in the laboratory, your technicians won't need to batch anything. So once again, with our pre-plated assays, we're saving money by having these, by having our plates being pre-plated, filled with master mix, etc. And also utilizing tearaway plates, which means that you will not have to burn through a waste test should you not have a full plate's worth of tests to actually run. And number 4, I talked about our COVID test and that being special in the fact that it's extractionless. First of all, an extractionless process once again saves a boatload of time. It saves about 15 minutes of tech time to plate samples. It completely eliminates the extraction process. And from an efficiency standpoint, it allows your throughput to be higher. I need to go back and say that all of our assays, to include our COVID extractionless assay, has a runtime of about an hour. So when you're needing to turn around results, and especially when it comes down to COVID, that runtime of an hour of PCR, regardless of your platform, is very important. We have, with our COVID extractionless assay, we basically have 2 steps, not 3. We take the specimen, we add lyse buffer to it, it's heated for 5 minutes to 95 degrees, it goes onto the plate, it goes onto the instrument, and it's ready to run. 2 steps, as simple as that. And from a laboratory standpoint, 2 steps as opposed to several others it's going to mean a lot from a throughput standpoint and also from a cost standpoint as well. So 45 minutes to an hour is what's saved from going extractionless as opposed to using an extraction process when it comes down to COVID. This next slide just gives an idea of how much, if needed, is needed to get started with us. We would like to say, and we know that we are lowest cost in the market by far. Our validations, we know, are the lowest cost in the industry. We do all of the heavy lifting. For instance, in COVID, validation is $2,000. All of our other assays, the validation may be $5,000. We know for a fact that there are others in the industry that may charge $30,000 or more for a validation. We know hands down that we are the lowest cost. We know hands down that we're the lowest cost with regard to our assays as well. And we're very confident about that. I'll just say that as well. So this slide basically gives you an idea of what a startup cost could look like, and what the validation costs, again, look like in terms of what we provide. This is taken in consideration utilizing a biorad instrument. We do have some other instruments that we use. So this is an idea. There's a small range here, but it again gives you an idea of that entry cost should the need be to create a PCR laboratory from start to finish. This is it, nothing more than that. So essentially, as I've stated before, and I'd love to recap it as well, we've got proprietary assays that are very robust and very robust in terms of being able to increase clinical workflow, clinical efficiency, and also increasing the treatment decision making for patients. We know that our COVID extractionless assay by far is also a game changer when it comes down to laboratories, regardless of the kind. We've got several, if not, and I'll say more than several, existing large laboratories who have utilized our COVID extractionless assay, especially in the height of Delta and also in the height of our most recent Omicron variant, with production of maybe 15,000 tests or more, who have basically shared with us that our extractionless assay was a game changer for them. It allowed them to increase their throughput and remain efficient, and also not increase their costs by doing so. We basically saved a lot of laboratories money. Our tearaway plates, once again, zero waste. And so at this particular point, when we're talking about also increased ROI, by working with us, we know that in a lot of instances, your ROI that you just saw in some of the previous slides, you can take advantage of that in less than 30 days. At this point, I am open for questions.
Great, Mariska. Thank you so much. What a great presentation. I wanted to tell all the attendees, if you have questions, to type them in the question box there, and we'll be happy to answer them. Oh, and here's one right here. Okay, Mariska, so how will your assays save our laboratory time and money?
Sure. So as I mentioned before, our assays are pre-plated. And essentially what that means is that our wells are already pre-filled. They're pre-filled with master mix, they're pre-filled with TAC. They essentially are eliminating the need to hand pipette all of that in a plate before actually being able to process a sample. And by having those proprietary plates or pre-plated assays already in its state, we're talking about a savings of 20 to 45 minutes per run. So when you're saving that amount of time, then you're saving that amount of money. By saving that amount of money, you increase your throughput. By increasing your throughput, you're able to maximize your ROI.
Okay, we have another question here. If we needed a full PCR implementation, what does the timeline look like?
Sure, if a full PCR implementation was needed, which for us that means lab design, equipment procurement, sourcing of staffing, etc., that timeline for us is 90 days.
Okay, here's another question. How long does the validation process take for the MLP assays? How much downtime can be expected in our lab during that process?
Sure. So if we're talking about an existing laboratory that already has its PCR machine and they're only interested in our proprietary assays, validation is actually surprisingly short. If I give an example of COVID, our COVID only extractionless assay, believe it or not, that validation could really be done in a matter of a couple of days. The validation itself really takes a day. If we add on an additional day for data review, that's where the couple of days comes in. Now, I will say that some of that's predicated on, a tech being able to be available for maybe about 4 to 6 hours in order to have that validation done. But if that's possible, that COVID assay can be done in a day or two. All of our other assays can be validated in 3 to 4 days. So if I go back to, something I mentioned earlier, which is, again, we're talking about ROI on lab service. If you're trying to capitalize on the ROI and some of the numbers that I presented earlier, then as you can see, in actually acquiring our assays and being validated for our assays, you really can capitalize on those ROIs in less than 30 days.
Okay, we had another question come in while you're answering that one. How does your standard panels compare to other molecular panels currently run by others?
Our standard panels reimburse at probably a much higher rate than some of the other panels, and that's what we found when in basically talking to some of our existing customers, and one of the reasons why they decided to work with us and they were interested in our assays is being able to have a robust panel from a pathogen standpoint, but also as a result, having robust reimbursements or an ROI as well. The other thing I'd like to add is that if I go back to just cost, you have the opportunity to take advantage of our proprietary robust assays, higher reimbursements, but the cost is where it's surprising, because we know that we will endeavor to beat any current price that may be found out there. So we know that we will be lowest cost in the market.
Okay, if you have any more questions, please type them into the box. And here's one. Are your plates compatible with our current PCR machine or instrument?
Yes, I'll say yes for the most part, but let me elaborate. Our plates are compatible with most open platforms. So as long as the platform or PCR machine is what we like to call it, is an open system, our plates are most certainly compatible. And to give some examples, I know I talked about a Bio-Rad 96 earlier. Bio-Rad Thermo Fisher is also a very well-known name in terms of instrumentation. And then, of course, there are some others. We are most certainly compatible with those systems.
Okay, great, Mariska. Thank you so much. I do want to remind everyone that we will have a PDF of today's PowerPoint, and I'll send that to all of the registrants. We also recorded today's webinar, and that will be posted online tomorrow, and a link will be sent to all registrants. Terrence or Mariska or any of our other panelists, do you have any closing thoughts?
So for me, and anybody else, Terrence, Joe or Erica, are free to basically also jump in. I just want to say I appreciate the opportunity to discuss molecular lab partners. I am very also excited to speak with anyone on the call. My contact information is listed here on the slide, email address as well as cell phone number. I will say also, Erica, Terrence, we're all able to assist you if you have additional questions that are not addressed here on the webinar. But we're also we'd be very pleased and looking forward to actually working with you as well.
Great, thank you so much. Terrence, you have any final thoughts?
No, I just want to again thank you, Chris, and everybody for your attendance, and Mariska did an outstanding job. Thank you so much for your presentation. Again, from a corporate standpoint, from my company standpoint, Unity Medical Alliance, again, we like to bring partners into the position onto the table. And again, working with Mariska, Joe, Erica has been a wonderful alliance. They bring a vast world of knowledge to the table, and we're very excited about what they have been doing for for different labs around the country. And I know that we can assist you in any way. Again, we're here available at your disposal. We'd be happy to do a one-off conversation to go specifically into whatever challenges you may be having within the lab, or to help you to maximize your actual ROI. And that's basically what we're here for. And again, we're very excited about being here in the Dallas market. This is my home, this is my community. And again, we appreciate what you and your staff have been doing for our community, particularly during this pandemic. It may not be stated enough, but I just wanted to take time out from the bottom of my heart to thank you for what you've been doing to help us to make it through this time. And I would just want to continue to help you to progress and do great things in the community. I am passionate about my community. I love the Dallas market and area. I'm happy that I was blown this way, and I say blown this way because I came from New Orleans, which is where I began my career in the medical space. But Dallas has been a wonderful change for me personally and for my family. And again, we are very much involved in this community and want to continue to help it. I love the healthcare world. I love everybody in the healthcare arena and everything that you do. And so many times it's just you're underappreciated. But we thank you so much. Thank you so much for everything. And again, Chris, we really thank you for the opportunity to present today and just to share some additional information and to be here as a resource. That's what we are. We are a resource. We are experts in the medical arena, in the diagnostic world. That's what we've been doing, and I know we can assist anybody. So thank you so much.
Thank you, Terrence, and thank you, Mariska, and thank you, everyone. We really appreciate the knowledge that you provided to our hospital members today. So without further ado, if anyone else has anything to say, I'm going to go ahead and prepare to end the webinar. So thank you, everyone.
Thank you.
Thank you.